diagnosis. Those, what means medical diagnosis? What means medical diagnosis? What is it? Diagnosis?
Finding the correct disease.
Find this list of the patient disease. This list of the disease. And so, the medical diagnosis should be write down and rather some rules for correct medical diagnosis. And those, the correct medical diagnosis, and try to see this is structure when you will prepare the diagnosis in your workbook for each topic next semester. Those. The general structure of the medical diagnosis. The first, main disease. What means main disease? How do you think?
The complication that the patient has currently.
Reason for
The reason
The reasons for the symptoms now. Because the patient can have some main disease maybe. But now patient admitted to the hospital, consult with the doctors because the patient has some symptoms. Disease is summarized, results summarize of the some syndromes, and syndromes it's result of summarize some symptoms. And those disease consist of the syndrome. Syndrome consists of the symptoms, the group of the symptoms. And those main disease, this is the main disease, and now the important disease now, and this is disease need to treat first. The second structure, complication. Of main disease. What mean complications of the main disease?
the other diseases caused by the main disease? Hypertension,
Problems.
The some disease starts, then disease can progress and can lead to more severe changes. It can lead to the maybe other disease development or other syndromes or other symptoms development. It's result progression disease. And those complications you should write down that after the main disease. Then first develop main disease, need to treat complications, more severe conditions which develop due to the main disease progression. And if main disease one, sometimes different variants possible, try to remember one. The complications, it can be many, depends how long the disease progress. And those main complications. And basically, if doctors write down not clinical and write down the final clinical diagnosis or pathological diagnosis, and the last sentence into the complications should be cause of death. Direct cause of death. What is the possible cause of death? I think you every time, if you say death, I ask you why. Due to. Death due to. Those.
heart failure.
The some organ fails, maybe heart failure, maybe or sepsis, but sepsis sometimes sepsis is disease. This is a secondary disease we develop due to basically other previously disease. It's result progression of disease.
Reasons of what?
Some general sepsis not lead, but complications of sepsis sometimes can be fatal. Sepsis it's not cause of death.
Shocks.
Shocks, any shock, septic shock, the possible cause of death.
Internal bleeding. Bleeding.
Bleeding and those bleeding. Not any bleeding lead to death.
Losing much amount of blood.
And if
Leads
losing
to
much
deficiency
amount of
and
the blood,
heart failure.
what pathological process, what pathological condition of disease development?
Hypovolemic shock.
Hypovolemic shock possible.
Anemia.
What kind?
Lung failure.
Anemia.
Post-hemorrhagic
Organ
anemia.
dysfunction.
What kind of post-hemorrhagic anemias?
Sickle cell. Oh, that is very difficult.
What kind of post-hemorrhagic anemias
Iron hematite.
can lead to hypovolemic shock?
Hematite.
Okay, and what is the kinds of post-hemorrhagic anemias possible?
Changing the viscosity of the blood to
No, since no, viscosity of the blood not change because it means
component of blood. I mean.
the complete blood.
Yeah.
It's not change viscosity. It's complete blood loss with the fluid, with the cells. And those, what kinds of post-hemorrhagic anemia is possible?
Мозг не грузит, если честно.
There are two variants. Not ready? Today? We will start from the workbooks. Acute and chronic post-hemorrhagic anemias. And those, what is the difference between acute and chronic post-hemorrhagic anemias? In both of the cases develop after hemorrhage. But why some case called acute, some case called chronic? Short what?
Process and leads to quickly.
And after acute post-hemorrhagic anemias every time death?
After acute maybe chronic.
After acute recovery or chronic.
Recovery of chronic stage.
Or chronic?
எல்லாத்துக்கும் ஒரு மாதிரி சொல்றாங்க.
Post-hemorrhagic, what does it mean?
After bleeding.
Finish with the cause of diagnosis and then discuss about anemias, the general moment. Those main disease, complications of main disease and cause of death. The difference, cause of death possible. And basically the cause of death is last sentence into the list of complications. And last position should be concomitant disease. It's maybe one, it's maybe more than one. Concomitant disease. Basically, the concomitant disease is other disease which patient has. But this is disease not connect with the main disease or its complications. And now, no, it's not severe disease and now no need to treat. As for example, the patient developed main disease myocardial infarction. It's main disease. Need to treat. Severe disease, of course, myocardial infarction, main disease. What are the cause of death due to myocardial infarction? What is the possible cause of death? Or complications of myocardial? Hypoxia and
Necrosis.
where?
Brain.
Necrosis in brain.
See, hypoxia and brain.
What?
Why brain hypoxia
If.
due to myocardial infarction.
Wait.
Myocardial infarction, the next one. In general. Hmm? Of course, heart failure, acute heart failure. And those myocardial infarction, main disease, complications, and cause of death, it's same. Now, some many complications possible. Okay, the short variants possible. The acute heart failure. But this is patient can have chronic gastritis. Possible. Of course possible. And there's where would it place chronic gastritis? In position of concomitant disease. Not lead to myocardial infarction, not associated with a heart failure, but no severe. Sepsis, no need to write down in concomitant disease. Or myocardial infarction, no need to write down in concomitant disease. It should be not severe disease. We not need to treat now. There's some other disease. Those, this is variant of the diagnosis. You should prepare each topics next term. Depend on the topics, different variants of main disease. This is three to connect and write down. Try to remember main disease, complications, and possible of cause of death for this is disease. Because this, all of this is position, you can find an equation for controls and for exam for each disease. And second, from second side, why you should prepare this is variant of task? Because in the exam you can receive clinical case and the control also. Then you can find equation, make a clinical diagnosis. Using this is case. That's how we make it. This is case. You not have additional question in theoretical part about diagnosis, but some practical skills can be to make a clinical pathological diagnosis. It's clear? Okay, and then we discuss some yes. Pay attention to them. No. Just start. Computer. Enemy definition. What does it mean? Definition. What does it mean? Enemies.
Deficiency.
Low level of the RBC.
In the blood.
The anemia, it's syndrome. Basically, it's syndrome. The few amount when the anemias are the disease, and those anemias is the syndrome which characterized decreased amount, reduction number of red blood cells and hemoglobin. Hemoglobin reduced. Those. And what are the possible causes for anemias? Why? Okay, there are some genetic abnormalities, but the results of this is genetic abnormalities. And
Decrease the formation of
why erythrocytes not enough?
Erythropoiesis is a problem with erythropoiesis.
The problems with the erythropoiesis. They're not enough produced, impair of production. Impair of production subdivided into two main branches. From one side, the problems in what organ? In bone marrow and bone marrow disorders. If bone marrow cannot produce and result in basically hypo and aplastic anemias. when the hypo and aplastic anemia is associated with a decreased amount not only red blood cells, decreased amount all blood cells. What bone marrow disorders you know, which can lead to hypo and aplastic anemias?
Can tumors.
What name? Tumor of bone marrow.
Leukemia.
Leukemias, as for example, the leukemia. Maybe intoxication, radiation can destroy bone marrow and resulting reduced amount of bone marrow, destruction bone marrow, and those not enough produced. The second variance, why not enough produced? If bone marrow correct, why problems with the production possible? Bone marrow produce, correct, can produce, but problem with the production happen. Why?
Iron deficiency.
If some deficiency, components of red blood cells not enough, and those it's called deficiency.
Yeah, I asked the game by Chesa Chesa said no. I checked it. Don't lie,
Do you check?
And those deficiency, not enough components. Iron deficiency important because iron, this is important components of the hem. And those result not enough iron, not enough hem, and not enough correct hemoglobin. And resulting not enough erythrocyte development. Micro and hypochromic anemias. Small size and the dark color because not enough hem. The second variance of anemias, deficiency, B12 deficiency and folic acid deficiency. And this is case folic acid and B12 deficiency. Vitamin B12 is important to DNA. And you know the correct DNA and correct during maturation, the nucleus, during maturation, nucleus should be removed from the cells, red blood cells, and some part of organelles also removed during maturation. The first, the blood cells with nucleus, but later during maturation, the nucleus removed, organelles removed, and a lot space for the oxygen connection. If incorrect DNA, complete resolution of nucleus impossible, and components of the nucleus stay into the red blood cells, resulting big cells with the components of the nucleus, hypermacrocytic, hyperchromic anemias, big size, intensive color. But what amount of the oxygen can connect more oxygen?
No.
No, because particles of organelles stay, the particles of the nucleus stay, and not enough oxygen connect with from the air, and those result in hypoxia. Big size, intensive color, but hypoxia again. This is problems with the imperial production. Second variance and second pathogenesis or etiology for anemias. Before we discuss about post-hemorrhagic anemias, anemias due to bleeding, and those produce enough, no problems with the production, but due to blood loss, anemia can start. And we said before that post-hemorrhagic anemias are divided into acute and chronic. What case called acute? Shot what? Shot.
Infection.
External bleeding due to a
Okay, external bleeding. You get scared your skin, the bleeding starts. You have the acute post-hemolytic anemia. No, post-hemolytic we are discussing. Do you have acute post-hemolytic? It's acute? Acute. No bleeding, acute. Get scarred your skin. It's acute? Acute. Bleeding? Bleeding. Acute post-hemolytic anemia start?
It's a question or answer?
It's question. Start or not start?
No. After,
No.
after massive,
What no?
massive blood loss.
Massive bleeding. In case of acute post-hemorrhagic anemias, if patient miss amount of the blood, massive amount of the blood, how you think? How much? How many percent?
30%. 30.
If 30% patient died. Of course. In case of acute post-hemorrhagic anemias, not chronic.
5 years.
20%. 20% of the blood. If patient miss the 20% of the blood, the acute post-hemorrhagic anemia start. If less than 20% of the blood, in case of the child, in case of the older person, the patient has the chronic other disease, background disease, the anemias also can start. Well, variants of anemias. But if less than 10%, the organism can compensate without the problems, basically. And those, this is depend of subdivided into acute and chronic post-hemorrhagic anemia. And those, what disease, what condition can lead to acute? 20%, how many? How many blood vessels have
5.
approximately? Okay, 5 liters. 20%, how many? 1 liter. And those, what disease, what conditions can associate with the miss 1 liter? Suddenly, 1 liter. It's lead to hypovolemic shock. But reasons, why? Injury, what?
Massive injury.
Massive injury, okay.
Main vessel.
Main vessels, such as
Carotid.
aorta. Okay, what disease of aorta, you know?
Aneurysm.
Aneurysm rupture. And those, in case of acute post-hemorrhagic anemia. Those, what is the main disease?
Aneurysm.
Atherosclerosis of aorta. This is main disease. Then complication, aneurysm. Next complication, aneurysm rupture. Next complication, acute post-hemorrhagic anemias. And next complication and cause of death. If you said it before, hypovolemic shock. Decreased cardiac output, the reduced reduction, and hypovolemic shock. These variants of diagnosis for you work with. Today topic. Those. In case of basically the post-hemorrhagic anemias, it's not main disease because the cause of bleeding, it's main disease. About acute post-hemorrhagic anemias, clear. The chronic post-hemorrhagic anemias. Why can be chronic post-hemorrhagic anemias?
Infection, chronic.
And infection. It should be post-hemorrhagic.
hypocoagulation of the blood.
and resulting
Uh, internal bleeding, generalized internal bleeding.
mhm. And what you can say about the amount of the blood in case of the chronic? Internal bleeding. The previous time we also discussed. Aneurysm, rapid internal bleeding start. 1 liter.
Small volume.
Small volume of the blood, but long time. Maybe 50, maybe 100, then 100 milliliters. But this is, the patient needs this is blood, volume of the blood every day, during long time. And resulting, if summarized, of this general volume of the blood, the amount of the volume of the blood can be more than 40, maybe more than 40% in general, but not suddenly, not together. It's maybe during 2 weeks or maybe during months. And those in this case develop chronic post-hemorrhagic anemias. Basically, the chronic post-hemorrhagic anemias, if patient has external bleeding and blood miss outside, GI tract disorders, or maybe gynecological problems and then menorrhage, metrorrhage, or maybe patient has coagulation problems, hemophilia, thrombocytopenias, and patient has also bleeding, nasal bleeding, for example. The chronic anemias can progress to iron deficiency, because this is iron with patient intake removed, and can progress later to iron deficiency anemia. Those. It's clear what is the difference between acute and chronic. It's short and long, and those acute can transform to chronic.
No.
Of course no, because acute it means suddenly 1 liter. In chronic, it's not suddenly. It's 1 liter during 1 month. It cannot be together. It's all 1 liter suddenly or 1 liter during months. What morphological change in organs due to anemias?
Pale.
Change color, become pale.
Necrosis.
In severe case, necrosis into the internal organs can be no shock, and the necrosis, the anemia, is result of the shock conditions. What is the change in case of chronic post-hemorrhagic anemias? The patient has blood loss every day during 1 month, maybe 6 months. Organ failure. What organ failure? Hypoxia. And those, what type of the dystrophy start due to hypoxia? If not enough oxygen, long time, the dystrophy changes start. Infarction is not dystrophy. It's necrosis. It's mesenchymal or parenchymatose. Because why?
Mesenchyma is mostly found in bone marrow, which is important for blood.
And those, due to not enough oxygen, the cells need to oxygen, or blood need to oxygen.
And
Cells and those, if not enough oxygen, the dystrophy start Parenchyma, of course. The changes start inside of the cell because metabolic processes start to change. The cells need to oxygen. Blood is only travel. And those, what if not enough energy because hypoxia, the carbohydrate cannot destroy it. And those, what type of the dystrophy start? Fatty dystrophy, parenchymatose, fatty dystrophy of the heart, parenchymatose, fatty dystrophy of the liver, and resulting maybe this is organ fail. The heart fail can be due to progression chronic post-hemorrhagic anemia, or maybe liver fail. No, liver is rare. Those, the fatty dystrophy, this is change reversible or irreversible? Parenchymatose fatty dystrophy. Reversible. At the early stage, if treatment start, maybe the source of the bleeding removed, or maybe suddenly, maybe due to some treatment, other variants of the treatment, the changes, if start, fatty changes into the excess organ, this is change can complete resolve and resume to normal. But if this progress, the middle drops or big size drops, dystrophy start, this is changes irreversible. And patient later can have heart fail, chronic heart fail, progression, and some other complications. Those. Forgot first topic. Try to remember the 11th topic. How compensate blood, miss of the blood?
Vasoconstriction.
Hmm?
Constriction of blood vessel.
No constriction of the blood vessels. No, and the regeneration start. What is the step? Blood regeneration. Stem cells back. How blood regenerate? In case of some changes in bone marrow. What kinds of bone marrow? What change? What happened with the stem cells?
They differentiate into different types.
Okay, differentiated and divided, and those into the bone marrow increase number of the cells. What is the name? This is extramedullary is third step. Now we discuss this first step. Hyperplasia. The hyperplasia red bone marrow. And those can be, if morphological change, if bone marrow can be studied, increase amount of the cells. If this is change not enough, the second step of change, ну что там? The next step, okay, the maturation and red bone marrow, it's mean the general hyperplasia. The increase the number of the cells, maturation increase. But change of bone marrow not enough. Red bone marrow cannot compensate complete.
Yellow
It's
bone.
thought it should be second.
Yellow bone marrow starts
The
to.
yellow bone marrow transformed into the red bone marrow. This is the second step. And those morphological change in tuber bone marrow also become reddish color. Now, if biopsy taken from the not only from the flat bones, take from the tuber bones, also red color, intensive reddish color, show the compensatory change. And third step, extramedullary
I know.
And those, if a biopsy reveal extramedullary hematopoiesis, it means this is patient developed before the severe anemia, which cannot compensate previous steps. Very severe anemias. And last group of anemias due to pathogenesis, not enough production if blood miss or loss of the blood, and third, why not enough red blood cells
Destroyed.
if
Destroyed.
If erythrocyte destroyed, of course. If erythrocyte destroyed, not want to live 100, 120 days and destroyed before. Those. The name of this is type anemias, hemolytic anemias. Subdivided into two types. Intravascular and extravascular. And those, what additional morphological change due to hemolysis of the blood? Okay, the hypoxia also. Hypoxia, extramedullary hematopoiesis also in severe case. Change of bone marrow can be found. But if erythrocytes destroyed, what's additional symptoms? Macrophages, okay, in hypertrophic macrophages, big cuts,
Hemosiderin.
hemosiderin, and organs become not pale color,
Brown.
color. And together with the hemosiderin, other pigment, and resulting skin also not pale,
Yellow.
yellow. And this is case the jaundice starts, pre-hepatic or hemolytic jaundice. Those conclusion about anemias. Basically, anemias, it is the syndromes which develop due to other disease development. But some case of anemias can be main disease. What case on what type? No case, because types is so many. What case of anemias can be primary? How you think? As for example, and those, in this is case, what etiology? Genetic reasons. If malnutrition, there may be problems in the digestive tract. Maybe eat enough, but why? It's deficiency, something due to GI tract disorders, inflammation, liver problems, and some others. The problems why this patient has malnutrition. But in case of genetic reasons, this is case main disease, cycle cell anemias, thalassaemias, etc. Genetic anemias, it is main disease. In other case, complications. Imposition of complications.
We can be cited.
Did you complete your today topic? In your work? Next semester.
This time everyone has to take subject individually.
Today, anemias. You are not no topic today.